keep on the same cadence and recognizing our healthcare providers at every point within all healthcare systems, not just within the state, but in the country, and I guess I could say globally. And then I also want to just recognize our communities as well. So I'll start with going over the Hartford healthcare numbers in regards to COVID-19. And so Becca's Hospital at this point has 3 positive COVID patients, and they're seeing 18 PUIs. Charlotte Hungerford's has 5 positive patients with 46 PUIs. Hartford Hospital has 65 patients with 79 PUIs. Midstate Medical with 9 positive patients and 7 PUIs. St. Vincent's Medical Center has 11 positive patients and 11 PUIs. HOCC, so Hospital of Central Connecticut, located in New Britain, has 22 positive patients with 42 PUIs. Wyndham Hospital with 1 positive and 9 PUIs at this time. So from acute care setting total census, we have 147 positive patients that we're seeing and caring for at this time, and we have 212 patients in-house that are PUIs, so that are being ruled out or ruled in for the disease process. And for our transition of care area, I guess you could say, so Behavioral Health Network has 3 positive patients and 1 PUI. For Community Health Network, we have 210 positive and 17 PUIs. And again, I'll talk about those 210 patients being a representative of the patients that we've transitioned out of Hartford Healthcare and are now at home getting care through the system. So total through the system, we have 360 positive COVID patients with 230 of those, 230 PUIs. And with I'll go back to the community health just a bit. I think we're now at over 1,600 patients transition. I'll double check that, and when I'm back on, I'll talk more about that. So that's a really good thing for the healthcare system. A few more things. So we've seen some spike in hospitalizations, I think, across the state, not just with Hartford Healthcare. And based on the conversations we've been having and the predictive models that we've produced and provided, this is normal. So we expected this. There's a few things that have changed. There's a few attitudes that have changed. But the most important thing is there's a few more testing that's been done. I should say more than a few more testing. A month ago, our limit was 150, and now our limit's, I think, 2,500. So that's really good. Can we expect this through the summer? I would say it's kind of too early to tell. But if I think epidemiologically, it's a higher probability that this is going to be the cadence. We'll have some increases, some minor spikes throughout the summer. And then obviously we're still questioning whether or not, or we're still seeing whether or not the resurgence in the fall as expected is going to happen. But it's too early to be absolute with that data. But at this point in time, based on our predictive model, we're going to hold through to that. Again, testing is critical. We've invested significantly in the community in regards to ensuring that we have a number of testing sites, a number of tests available for the community. So again, 2,500 is a commitment, daily commitment from Hartford Healthcare to the community at this time. And we're trying to get to everyone. One of the things we're using, as I said before, mentioned before, is our mobile testing unit. Going to community health centers, homeless shelters, nursing homes, which we've worked really closely with to ensure that that we're getting to such a critical population. I think there's 215 nursing homes in the state, and from the 215, about 65% of them has been impacted by the COVID-19 disease process, which is very critical. And assisting the state with testing. So places such as the corrections facilities, Hartford Healthcare is present in helping with facilitating testing, which again, very critical area. So at this point, I want to introduce one of our definite heroes in the fight in COVID-19, someone that's on the front line, someone that I respect significantly, and it's Audrey Scott, who is the assistant nurse manager at Hartford Hospital in emergency medicine. So Hartford, Audrey, thank you.
Hi Keith, thank you, and the respect is definitely mutual. I'm here today to discuss what's next for the emergency department. As the community reopens, we are expecting an influx of patient volumes back to some of our normal volumes that we're used to. Through the COVID crisis so far, our patient volumes have decreased, but the critical nature and acuity of the patients has increased. So it has still been a challenging time, but now we're readjusting for what we expect, which is many of our patients who we don't suspect to have COVID, but having other ailments that may have been hesitant to come to the emergency department during this time to now come in to be seen. And so we just want to assure everyone that we're preparing for this. I work with an incredible leadership team that is constantly planning, and we're still taking all the safety measures and precautions to ensure that our patients are safe. We are still using our forward triage area, as we call it, outside, so we're screening every single patient coming into the building. We are then delineating whether we suspect a patient to have COVID or not and placing the patients in those appropriate areas of the department just to maintain safety. So we are prepared. We are always adaptable and we're ready for whatever's next, and we will continue to provide excellent patient care to all of our patients. And with that, I will introduce Dr. Jonathan Gates of surgery, trauma surgery.
Audrey, thank you very much. I'm Jonathan Gates. I'm the director of the Trauma Center at Hartford Hospital and the chief of the Trauma Network at Hartford Healthcare. I think it's important that we get the message across that we are able to take care of patients despite this COVID crisis. So we're able to take care of those patients, but also patients that come in as victims of trauma and really acute care surgery as well. And that encompasses perforated bowels and gallbladder disease and appendicitis and things like that. I think over the last several months, we've proven that we can do it safely at the height of the crisis, and now that it seems to be tapering off, I think that we'll be able to ramp up the operative cases that need to be done. Certainly during this period of time, there have been a lot of patients who have diseases that need to be addressed and have been putting it off. And I'd like to reassure them that the hospital has gone through extensive planning in order to be able to take care of these patients safely as they come back for the care that's so needed. That includes testing all of these patients preoperatively to make sure they do not have the COVID virus. And then again, all of our healthcare workers are tested daily or queried daily to make sure that we're all healthy and that we're not bringing it into the hospital. And that's done extremely good job in making sure our healthcare, our workforce is healthy. But in doing that, we're able to cohort the COVID patients in certain areas of the hospital and then take care of the general population who does not have COVID in other parts of the hospital as well. So I am very confident that the hospital is able to ramp up and take care of the patients that need the surgery that's so necessary now and to do that safely. Thank you very much.
All right. Any questions? Actually, before I get into that, I said 1,600 for transition. We're at 1,200 and I think 66 right now. That's patients that's been transitioned from our acute care setting back into the community or back into lower levels of care. So, any questions?
Yeah, hi, this is Tim Lamers from Fox 61. I do have a question.
Sure.
When you had mentioned that hospitalizations did tick up yesterday, you had mentioned that based on your models that was expected. Could you elaborate on that a little bit? Do you mean just by random chance some days it may go up or down just based on how data is distributed, or was there some other reasoning as to why you thought that was expected yesterday?
So a few things that are happening that will affect hospital census, I think, over the next few weeks. So one thing that you will see more of, so people are now coming back to the hospital. The hospital is a safe and trusting place to be to get care. A lot of our community members use the hospital for many reasons, and we'll see that. That's going to increase. I think that's going to increase significantly. In fact, in some populations, you will see more than a significant increase of that level of that population coming back to seek care within a hospital. The other thing is we're testing more, so there's significantly more testing available, which means for patients that have certain comorbidities, the conversation as to whether or not you should not only get testing, but if you're now positive, should you be followed more closely by your provider, and hence should you be in the hospital or be seeing at the hospital? So that's going to happen more as well. So it is an expected change, I guess you could say, based on the resources, based on the steps that were taken, based on what we had to do for limitation for hospitalization over the last few months for all hospitals or health systems across the country. So that's data, that's numbers that we expected to see rise, absolutely.
Hey, Keith, this is Emily from The Current. I just want to clarify what you mean there. So are you saying that you expected to see the increase in hospitalizations as people with milder cases of COVID come to the hospital, milder than they would have come to the hospital before at the peak of the pandemic?
I don't know if that's exactly the case. What I know is, for example, if someone has certain level of comorbidities from a provider perspective, they would be encouraged to now definitely look into the opportunity to go to the hospital and get checked out, so to speak. And people are using that opportunity. People are now trusting the hospital much more. That's key. So people are reaching out. Citizens are getting in contact with their providers, their primary care, and ensuring that the level of care that was lacking, or the level of focus on their specific care, preventative care, that was lacking over the last few weeks, that they're paying more attention to that. And that might include people that are positive that has comorbidities, yes.
Okay. And then can you talk a little bit about what you expect over the next few weeks as far as hospitalizations go, particularly in regards to the reopening, and if there is going to be some kind of peak from the reopening, when you might see that in the hospital?
It's very hard to actually put a date and time on it, right? So if you look at incubation period, if something happens this weekend, for example, based on the incubation period, would say within the next week or 2 weeks, would see fallout from that. I think people are I generally think people are still very responsible at this point. Most of the gatherings that I've seen seem to be very organized, seem to be very respectful of social distancing criteria. Most people that I saw in public were wearing their mask, which is the right thing to do. So it's hard to say an exact time period. I would say if we should look at our biggest opportunity over the last few months has been this weekend. When you look at it, like a lot of people got together, a lot of families used the opportunity to get together. And from that opportunity, if we should see positives from that, we would, based on the incubation periods we're looking at, you'd see within the next week or 2 weeks, you'd be seeing fallout from that, yes.
Thank you.
Yeah, absolutely. Anything else? Anyone else? Tina, you had a question?
We do have a question
Absolutely.
from Facebook. Are pregnant people more vulnerable to COVID?
So, pregnancy falls into that vulnerable population, that comorbid vulnerable population. It was identified by WHO initially, and CDC supported it as well. So, based on that, yes, they're considered to be. Again, I would stress the same exact thing that I say to everyone. If you're healthy and you have any form of symptoms or you feel like you've been exposed, reach out to your PCP. If you need to go in to see your PCP. If you need to have a discussion using the telehealth services, reach out and communicate as much as possible. And communicate in regards to very important exposures and or symptoms. Anything else? No? I mean, the good thing is if you looked back 2 months ago, month and a half ago, it was difficult for us to have these conversations right now. Like, we've transitioned very well, and a lot of this has to do with the commitment from healthcare providers, but I think most of this has to do with what the community themselves have done. We've done a very good job. I think Connecticut has really stepped up in regards to social distancing and universal masking, and the commitment from big industries have really committed, and we're now in a very much better place. And the hospitals are much safer, and elective surgeries are moving forward. So I think this is the introduction to a new normal, and I think we're doing very well to embrace it. And we look forward to serving the community as much as we can in the coming future. All right. Thank you so much. Enjoy your day.